We will go straight into section A of the panel, which is Jojo, Inu, Puni, and Kat, in that order. 7 minutes, guys.
Hello, can you hear me? Can you hear me from the back? Lisa? Thank you. Good morning. My name is Joakim Peter. Most people call me, and I'm known by most as Jojo. I'm part of an advocacy network, actually two advocacy networks that we have set up. One is called COFA-CAN Community Advocacy Network, and the other one is Micronesian Health Advisory Coalition, which Innocenda is the co-chairman of that group. We've been working very hard in the community and with the government partners in trying to, address certain issues that are affecting the lives and the health, mostly for Micronesian citizens here in Hawaii. So it's kind of hard to follow a poem like that from Kathy. And that basically speaks to the thick racial tension that I think all of us are aware of. If you haven't been reading the papers or been watching the news, there's new things happening within the healthcare structure of citizens and residents of Hawaii that has sort of pushed the Micronesians from the Medicaid or the program that's traditionally created for low-income to no-income citizens and residents of the community. So we've pushed those Micronesians out to the new healthcare connector. And so you have people who don't have jobs and actually are now signing up to on private insurance. And we have a lot of implications there for problem for this community. So a lot of us have been working very hard, trying to lobby. First, we tried to brought up the issue with the governor to again, to stop the move. We've been working with the legislature. We haven't been successful so far in trying to. We've also been working with the congressional leadership in trying to bring this issue up to the federal government, because all of this started in 1996 when the federal government reformed the welfare system and basically declared by default that COFA citizens are illegally present in the nation, so therefore they will not be eligible for any kind of the safety net programs. So ever since then, we've been working and trying to get that fixed, but in 2009, the state of Hawaii decided that they were going to move the citizens from the COFA nations to a smaller or a more restrictive medical coverage called Basic Health Hawaii. And that's when all of the fights started in the state. And we took that case to court, and it went as far as the Ninth Circuit Court, and they ruled in favor of the state, basically saying that the state can discriminate because the Congress discriminated in 1996. So then the state government made the move last November that they were going to move everybody, all of the Micronesians, the COFA citizens who are between the age of 19 and 64 and non-disabled, to about 7,700 people onto the Health Connector. And if you know anything about the Health Connector, it's really not set up for people with low and no income. It's actually set up for people who are working, who have some income, but also need help with paying for health insurance. So currently, that's kind of like the current struggle that we have right now. We're trying to help people understand the idea of health insurance, and they have all of these plans. They're receiving all of these letters in the mail from insurance providers that they have no idea. They don't understand because it's not detailed in their own language. It's all in English, very technical language, and old folks are basically receiving this, so they're coming to us, and we're trying our best to try and explain all of this. So at the same time, we're trying to work with other service providers and partner groups within the state to kind of like help us to stand on our side and to show everyone why you should not, all of even the logical economic reasons why this thing will not work, because it will actually end up costing not just lives of people, but actually, cost the money that the state said they were going to save. So one of those logical ways to explain this is if you deny people health care, and like in the case of the COFA citizens, like the way the PHH was set up is that they will not pay for dialysis and radiogenic treatment, but if they show up in the emergency room, then they will pay for it. So not only will the people die by the time they show up in the emergency room and they're surely on their way to dying, but the cost will be much higher when you're trying to treat that, and when it gets to the emergency rooms level. So there seems to be a lot of this. It's almost like what we're battling within the whole movement is that we're trying to have people realize the logical reasons why they shouldn't do this, but at the same time, it's like we're trying to get everybody to be aware of what's going on here. But it's a very difficult, it's hard to talk about it in 5 minutes, but I encourage everyone here to please educate yourself about what's going on. We have a website that Ula will share with you later on, where we put all of our stuff on there, and you can go on our website and check out the certain things that we're working on. So, thank you.